Millions of people are being prescribed GLP-1 medications right now for weight loss. They might be walking out of their doctor's office with not a lot of education regarding the side effects or how this medication actually works on their body. My name is Brianna. I'm a GI nurse practitioner, and I see the fallout from the lack of education about side effects in GLP-1s pretty much about 3 to 5 times a week. So today we're going to get some education on board, and we are going to fix that. So today we are going to cover what a GLP-1 actually is, what it does inside of your body and how it acts, and then also the major GI side effects and how to identify them and what to do if you experience them. So if you are someone who takes a GLP-1 or your loved one takes a GLP-1, I hope you stay to the end so that you can get some more education regarding how this medication works and what side effects you might come across while you're on these medications. So what does GLP-1 stand for? GLP-1 stands for glucagon-like peptide 1. It is a hormone that your body already makes naturally in your gut after you eat. What is the purpose of the GLP-1? So its job is to signal your pancreas to release insulin to tell your brain you're full and to slow down how fast your food leaves the body, basically. So that's why when you're on a GLP-1, you don't have appetite, or maybe you're not as hungry as you would normally be any other time, right? The medication job is to mimic that hormone, basically, but at a much stronger and longer lasting level than your body produces on its own, right? Major GLP-1 medications that we are seeing on the market or popularly used right now, whether that is for weight loss or for its main purpose, which is diabetes type 2, is Ozempic or Wegovy or semaglutide. So these are the same medications. They have a brand name, a trade name, and then a compounded name, just depending on where you get it from, what pharmacy you get it from, etc. So Ozempic, Wegovy, semaglutide is the same with Mounjaro, Zepbound, tirzepatide. Again, trade name, brand name, compound name, right? We also have Trulicity. I think that name is dulaglutide or something like that. I'm not dulaglutide. I think that's what it is. And then also Victoza, which is liraglutide. So these medications are the most popular medications that I have seen. I've also seen now that patients are currently taking GLP-1 in pill form. So I've seen Ozempic, I believe, or Wegovy in pill form that they just take, I think it's once a day. The injections you typically take every 7 days. So you'll choose a day, inject yourself every 7 days for a certain dosage. And then typically you go up and then you stay at a maintenance dose, etc. So those are the most popular medications that we have seen on the market thus far right now. So, as I mentioned before, these were originally developed for type 2 diabetes, again, to help the A1C to come down, curb the appetite so we're not eating all the bad things we shouldn't put in our body that elevates the A1C. And so that was what it was originally made for. It has now been used very widely for weight loss, etc. For some people who may have had weight gain and their A1C has gone up, etc. So that is what we're seeing right now. So these medications have a mechanism of action that are affected by 3 things in the body. So the first is the pancreas. What the pancreas does is it stimulates insulin release when the blood sugar is high, right? What that does is suppresses glucagon. Glucagon is the hormone that raises blood sugar. What this affects is to make sure you have better blood sugar control. So that's the first part. Second part is the brain. So GLP-1s affect or work on the hypothalamus. So it tells the brain that you are not hungry and you eat less, basically. So that overall affects your appetite to say, I'm not hungry, I don't need to eat, equals weight loss, right? The third thing is the stomach, which this is really big in GI, and this is something that I always educate my patients on all the time. GLP-1 slow the gastric emptying. What does that do? When it slows the gastric emptying, it leaves food in the stomach longer. So you're not as hungry, which means you won't eat, which means you will lose weight. However, that is really the most important part when we're talking about the side effects and the GI side effects of all of this, is because if you delay the gastric emptying and slow everything down and keep things in the stomach longer, some things start to happen. You start to get other side effects: nausea, vomiting, constipation, heartburn, indigestion, all of those things, because your gastric emptying is not operating at the regular rate that it would be, because it's slowing down because of the medication. So essentially, your gut literally just has to get used to its new normal, right? I'm used to processing the food at an adequate speed. And then you put the GLP-1 on top, and now I have to adjust to slowly processing this food through. And it is adjustment. It's an adjustment period. Your gut has to get acclimated to that. And so sometimes it's not always smooth. Sometimes you have to titrate the medication. Sometimes you have to come off of it. Sometimes you have to switch it. Just depends on how your body reacts to having these medications in your system. So let's go through the GI side effects. What you need to know about those particular side effects, and when you should see a doctor, or what you should actually do about it. So the first symptom we have is nausea. Really one of the most common side effects, especially in the first few weeks of you starting a GLP-1, you might see that with the initial dose. Again, your body is just getting used to being slowed down. It's caused by the slowed gastric emptying that we talked about earlier. Food sitting in the stomach longer, your stomach is sending distress signals, what's going on, right? What to do? We typically tell our patients to eat smaller meals, right? Maybe snacks. So instead of the traditional 3 meals a day that you typically have, maybe 4 to 5 meals, or just small little snacks in between. You want to avoid high fat foods, so really greasy foods or fried foods, etc. If the goal is weight loss, then we shouldn't be eating those things anyway, but I get it. So you want to avoid those kind of things. You also want to avoid very spicy foods. Sometimes, I don't know how y'all eating spicy foods, and there's spicy foods to the point where you can't even enjoy the food. For me, that's not fun, but people love spicy foods, and that would be something I would say to avoid. Things that can help you: ginger tea or ginger candies, ginger chews, etc. You can also talk with your provider regarding the dose. Maybe the dose is too high. Maybe you need to be on a lower maintenance dose. Maybe the titration that you were given initially is happening too fast, so we need to slow it down. So those are the kind of things that I would talk to my provider about. The next symptom is vomiting, which happens not often, but it can happen. It's mostly when patients overeat. Again, we talk about the stomach and the capacity, and it cannot handle what it used to handle. So if you're overeating, or maybe eating to where you used to, or consuming the meals that you used to and not eating smaller meals, sometimes your stomach is at capacity and it's full, and you might need to feel like, oh, I need to vomit, I need to get it out because it's too much. Typically that's what we see on this side. And so I would just say, again, break up your meals, etc. Now, if you are vomiting and it's happening repeatedly, this is not normal. This is maybe not due to the GLP-1, or maybe it has the GLP-1 is increasing these symptoms. You definitely need to go talk to your provider. Definitely probably need to be seen in the emergency room for further assessment. Again, I'm not your doctor or your nurse practitioner, but I would say that that is not normal, and you definitely need to go get that checked out. Third symptom we're talking about is diarrhea. I have not recently started seeing people have diarrhea lately. That's not really typically all that I have seen. But diarrhea to me is a little anomaly, right? Because if everything is slowing down, you would have constipation instead of diarrhea. So I had to do some research of my own, because to me, that really didn't make sense. What I found in my research is that because of the GLP-1, motility becomes inconsistent, and the gut tries to overcompensate. And sometimes the GLP-1 just slows things down. Sometimes you can have something that happens for the opposite, right? And if it's the opposite, then it's going to be diarrhea. Again, very rare symptom. I just started seeing it recently, but I'm just like, oh my gosh. So it does happen, I guess, because the gut is trying to overcompensate for its normalcy that it used to have prior to you starting the GLP-1. What can we do about this? Stay hydrated, electrolytes, liquid IV, or whatever kind of stuff you want to put in your drink. Sports drinks that have electrolytes like Gatorade is always fine. Always want to avoid high-fat foods. And then you can always consider a probiotic, right? I am an Align baddie. I love Calltrail or any kind of probiotic that you like, but you can start that to try to balance things out. You guys know I always talk about probiotics and it balancing out the good and bad bacteria to help with the gut flora. You can never go wrong with a probiotic, so you can start that as well if you're experiencing diarrhea. Constipation is what I see the most of. I see the most of constipation. Again, everything is slowed down, sitting in your stomach, which means you probably have less bowel movements or move your bowel less frequently than you would normally do without that medication on board. Typically, what I typically say to my patients is that you need to make sure that your diet is in tip-top shape. What I mean by that is instilling high fiber foods. Fiber is always going to help with bowel regularity. So you need to be eating green vegetables. You need to be eating apples, high fiber foods, chia seeds, okra water, whatever you can get. Even if you do a fiber supplement, psyllium husk, benefiber, metamucil, whatever you want needs to be in your diet. We don't prescribe GLP-1s, but I wish certain people who gave the GLP-1s would just say, hey, you can get ahead of this now. Everybody should be on fiber or having high fiber foods because it's really a healthy, balanced diet. On top of that, some patients see very severe constipation and it's just like, oh, I can't go unless I'm taking something. In those instances, we typically recommend for our patients to do a stool softener. You can do stool softener over the counter. Miralax is also safe. Miralax we love. It's an osmotic laxative, so it draws in water from the body to make things softer so that it can pass easily. So if you're already doing a balanced diet and then you put some Miralax on top, maybe you do that every now and again if you're having issues, then that works. Also increasing your water intake. Water is so important with constipation. I can echo this to the high heavens. I repeat myself about this at least 6 to 8 times a day. If you are not drinking water and hydrating, you're not creating the lubrication that you need for things to come down out of your colon in the first place. We're losing the plot here without the water hydration. We definitely need to do that. But you can always talk to your provider about what is best. You can talk to your provider about prescribing you a stool softener. You can get stool softener over the counter, whatever you like, but you need to also be moving things along because when you're constipated and it's very chronic, other things start to happen. You become bloated, you become gassy, you have abdominal pain, and we just don't want that. So those would be my recommendations or tips for that. I'm not going to say recommendations because, again, I'm not your doctor or nurse practitioner, but based on what I've seen, those would be the tips that I would share. The last thing that I'll touch on is gastroparesis. Again, gastroparesis in layman's terms means basically stomach paralysis, where the stomach is not emptying properly at all. We typically see this with delayed gastric emptying, meaning your stomach is not doing what it's supposed to do or it's decreased, right? GLP-1s don't typically cause gastroparesis in healthy patients, but it can unmask it if you were already at risk for it. Typically, we see this in patients who are a type 1 diabetic, who are insulin dependent. I see gastroparesis in some of the symptoms of gastroparesis is if you are feeling full after just a few bites of food every single time. If you have severe nausea and vomiting, or you're vomiting undigested food hours after you eat, maybe you have bloating, maybe you have upper abdominal pain. If you had these symptoms, I would absolutely talk to your doctor, your provider, gastroenterologist, whoever it is, because this isn't something to push through. This is something that has to be tested, and then also medication to help with those. If staying on the medication is the benefit outweighs the risk. So for example, if you're a type 1 diabetic and you're on insulin, you have to be on insulin. So of course you would need medication to help with the gastroparesis. For people who have GLP-1 who may experience gastroparesis, well, you can literally just titrate off the medication and come off of it with your doctor's guidance. And that will particularly help with those symptoms. So that's a big one we see a lot of. Again, you don't want to push through that. It doesn't feel nice. Anytime that I see any patient kind of dealing with that, it's not the quality of life you want to have. So definitely get that checked out if you are experiencing those kind of symptoms. And last but certainly not least, we have acid reflux or worsening GERD. Now, again, we keep talking about, oh, the food's staying in the stomach longer, etc. Same thing. If the food is not digesting properly and it's in the stomach longer, you might have indigestion. Sometimes when the stomach is not processing the food the way it's supposed to be, that stomach acid kicks up and say, what are we doing? We need to get this moving. And then you have acid reflux, or you have acid that comes up into the esophagus. You might have that burning sensation. You might just, again, have that bloating or maybe some upper abdominal pain. When the stomach is full and it pushes up on this lower esophageal sphincter here and weakens it. So things can come up a little bit easier when you have this, right? What do we do about that? Again, we want to make sure that we are watching our diet. So no fried foods, fatty foods. Sometimes for patients who already were predisposed to acid reflux or GERD, will say their symptoms got worse and they already have some trigger foods off the top of my head. Citrus, marinara sauce. So sometimes people have spaghetti or ravioli or something like that and say, oh, I can't do no tomato, I can't do no citrus, I can't do orange juice. Again, processed foods, so things that are fried, things that are high in fat. Some people have issues with even chocolate or alcohol. So you just want to possibly keep a food journal to say, hey, what's triggering me to have this? However, with the GLP-1, it's just the mechanism of action for the medication. It's in the stomach longer. You might have some indigestion. You might have some reflux. There are some over-the-counter reflux things that you can do. Gaviscon is a liquid one. It's known for its fast-acting relief. Nexium, of course. Pepsid AC is always a good one. But again, if this is something that becomes severe and you're having symptoms more than 3 to 4 times a week, I would talk with your provider and just see where you can go from there. Is it going to be a thing where you can come off of the GLP-1 because you're having such excruciating reflux symptoms, or is there medication that you need to take while you're on it? All of those things can be discussed at your doctor's visit. So let me give you a list of questions you can take to your doctor if you guys are having a discussion about GLP-1s, whether that's for diabetes, weight loss, or both. What kind of questions you should be asking to get the lowdown, because I feel like maybe not a lot of people are asking these questions, or maybe they're asking their questions but maybe not getting the information. I don't know. So let's give you some questions. So first, what side effects? Overall, what side effects does this medication give you? Specifically, what GI side effects should I expect and how long can they last? You want to ask about your titration schedule. What is a titration schedule? Can we go slower if I'm not tolerating it? Can this be switched if the medication is not working, but I still want to be on it? What's the options for that? Are there foods that I should avoid while I'm taking this medication, right? If you have a history of GI symptoms or GI issues, so if you have a history of chronic constipation, if you have a history of acid reflux, if you have a history of IBS, is there anything specific that I should watch for? Is there any of my symptoms that could get worse because I'm on the medication? That is literally a big one if you already have GI symptoms. What else can I think of off the top of my head? Sorry, y'all. Will you need monitoring? How often am I being monitored? Is this blood work that I need to do, etc.? And then any emergent symptoms that you should be seen at the emergency room for. I had this symptom, but it's excruciating, or it's increased, or I just don't feel right. What should I look out for and go to the emergency room to be assessed for if I had those symptoms? So I wanted to make this short video because I see this so much, y'all. I see it so much, and I just was like in my head yesterday, that's enough. You know what I mean? I try to educate my patients as much as possible, but it just seems like there's a gap in education when it comes to GLP-1s, or maybe we are excited about starting our weight loss journey and we're not asking the questions. Or is this a provider or doctor thing and they're not educating it properly? I don't know. All of those things seem to be at bay. And so I just wanted you guys to be educated once you start the medication, or you're thinking about getting on the medication, about what side effects you can incur, how the medication actually works, what does it do. I love educating you guys in my own way, of course, and especially so that you guys can understand, because I know a lot of people would throw out big words and be like, oh, here's your prescription, go ahead and go. But I like to educate on the way that you guys can understand, with all of my personality and moving shoulders and this and that. That also brings me joy that you guys understand. I've had a lot of people who make comments and say, I like the way you explain stuff. I can definitely understand it. And so that's my only goal here. You just deserve to know what's happening in your body and to it. So I'm a GI nurse practitioner. I know I said that at the start of the video, but this is literally what I do every day. 5 days a week, 15 patients a day. I see it most prominently in multiple patients. So that's why I wanted to do this. But if you love GI topics and things that you would want better explained, definitely subscribe to my channel. I'm here for all of the education topics that you will need. So if you enjoyed this video and found it helpful for maybe you or your loved one, definitely subscribe and share with your friends or loved ones. Click the link, whatever you like. And I'm going to be doing videos in May, all May. I'm trying to do a video a day for 31 days in May. And so you are going to get some other GI topics. You're going to get some book content, some fragrance content. You're going to get a lot of stuff. So if that's something also you look forward to, definitely follow me, give me a follow or subscription, should I say, and then like and share, comment if you have questions, and if there's something else that you would like for me to talk about. If I have the knowledge, I'm definitely open to doing it. Hope you guys enjoyed this video. Bye.